Hello, I'm Dr. Grace, a board certified family doctor and a clinical psychologist. Welcome to Weekly Minute with Dr. G. Let's talk. This week we're talking about H. pylori infections. So what is H. pylori? H. pylori is a bacteria that hides in the stomach lining to be specific, and it burrows itself in there, tunnels itself in the lining, and therefore it protects itself from the acid that is in the stomach naturally. So how does H. pylori spread? How do you even get it? Most people get it in childhood, but they don't know because they do not have symptoms. It's usually spread person to person, and it's usually by either poor hand hygiene or contaminated food or drink. And people who are in close proximity to people who have H. pylori, either through saliva or vomit, and even in crowded places, you're more likely to get H. pylori. So, like I said, some people do not know if they have it because they do not have any symptoms. Some will get that burning sensation, stomach pain, nausea, loss of appetite, a lot of burping or bloating. Others actually get more serious where they're vomiting blood, where they have problems swallowing, their stool is black, meaning that there's blood going through the system. They'll get their very severe pain. They need immediate medical attention and treatment. H. pylori infection puts one at a higher risk of stomach cancer. And so the process is long-term exposure, long-term infection with H. pylori leads that lining to get inflamed for a very long time, which leads to chronic gastritis. And then after chronic gastritis, those cells are so inflamed, so irritated, and therefore they start changing. So you can get ulcers. You can also get abnormal changes, which is now puts you in a higher risk of getting cancer. So other things that could cause stomach cancer include smoking, be it tobacco or any other substance, alcohol. If you have a family history of gastric or stomach cancers, you're at a high risk. And like we said, if you have a long-term untreated H. pylori infection. So how do we diagnose it? We have a couple of ways to diagnose H. pylori. It can be through breath test. The most common is through a stool test. We also have blood tests, but the most definitive or the most accurate is an endoscopy where they go in with a camera, they take a little bit of meat, they look at it under a microscope, and they do a biopsy to tell you whether you have H. pylori, but also whether your cells have started changing, and which puts you at a higher risk of stomach cancer. Thankfully, H. pylori is treatable. We do have antibiotics that treat H. pylori. It's usually a combination of 3 or 4 antibiotics plus an antacid, which you take for 14 days. It's very important to take it for the long term because, like we said, it's in the lining of the stomach, it's protected, and therefore the antibiotics have to work for a longer time to be able to get to the bacteria and completely clear out the bacteria that one has, so it can be fully treated. How do you prevent yourself from getting H. pylori? Good hygiene. Wash your hands regularly, drink clean water, cook your food properly, wash your fruits completely, and also a healthy lifestyle, no smoking, no alcohol, increase vegetables and fruits, seek medical care, complete your antibiotic course, make sure you finish all your medication so you can completely treat the H. pylori. That's it for H. pylori. If you have any questions about H. pylori infections or stomach cancer, comment and we'll be glad to help you. We'll see you next time.